Every year, thousands of women die from cervical cancer, a disease that is almost entirely preventable. A medical intervention now exists that successfully stops 95% of these cases before they can even begin. These teal particles represent the human papillomavirus, or HPV. It is the silent biological culprit that infects healthy cells and drives this global cancer epidemic. To counter this threat, scientists engineered the HPV vaccine, a tool designed to prime the immune system against the virus's most dangerous strains. Despite the vaccine's availability, immunization programs often face significant public hesitation. In a digital environment where rumors and panic outpace clinical data, social media misinformation has become a primary barrier keeping patients away from the clinic. Overcoming this obstacle requires us to ignore the noise and build a three-layered defense system based on proven science. The first layer of defense is personal immunity, which is often blocked by the physiological myth that the HPV vaccine causes female infertility. The biological reality is the opposite. By preventing the precancerous lesions that frequently lead to surgical uterus removal, the vaccine actively preserves a woman's long-term reproductive health. Another misconception is the vaccine is useless once married or sexually active. While childhood administration offers the highest protection, it remains effective up to age 45, providing a vital shield against new, aggressive strains not yet encountered. We must also address the fear that the vaccine carries a high risk of severe, debilitating side effects. Statistics from organizations like the CDC show that severe reactions occur in less than 1 in 100,000 cases. Most people experience only minor inflammation or a light fever that clears within 24 to 48 hours. Rejecting these unfounded physiological fears is the mandatory first step to securing individual safety. The second layer of defense involves dismantling the myth that HPV is exclusively a female problem. Males are equally susceptible to the virus, facing severe risks for penile, anal, and oral cancers. Halting the virus entirely requires herd immunity, a roadblock stopping the physical transmission of infection through a population. When boys are vaccinated, they sever the transmission chain. This drastically reduces the probability of spreading the virus to female partners, strengthening the entire network. Vaccinating both sexes is now the established public health baseline in many advanced nations, as recommended by the World Health Organization. True disease eradication demands that we treat vaccination as a collective community shield that protects the entire population. The final layer of defense addresses a behavioral myth, the assumption that a vaccinated individual no longer needs medical screenings. This medical brush and slide are essential for routine screenings. While the vaccine neutralizes the deadliest strains, these tests are still required to identify less common variants. Combining the vaccine with a pap smear or a VIA test every 3 to 5 years creates a nearly impenetrable clinical defense. A holistic shield also relies on the body's natural immune system. When healthy, white blood cells can often identify and clear the virus independently, long before it causes damage. Maintaining this internal system requires specific biological inputs, a diet rich in omega-3s to support cell health, and consistent deep sleep to preserve hormonal balance. Lifestyle choices also play a critical role. Smoking drastically increases the risk that an HPV infection will mutate into aggressive cancer. By combining the vaccine, a community shield, routine screenings, and holistic health, we possess the absolute blueprint for a cancer-free future.